Hello and welcome to OffBlueMedical. Today I'm going to show you an easy way to remember the familial dyslipidemias for the USMLE for step 1, 2, and 3. So here are all of the familial dyslipidemias that you need to know for the USMLE. We have 4 types and they are numbered. So type 1 is hyperchylomicronemia, and we have type 2, type 3, and type 4. And each one of these is inherited in a different way. So they are familial. Some of them are autosomal recessive and some of them are autosomal dominant. So to get started, you have to know the names of these. So the first one is hyperchylomicronemia. This is type 1. Hypercholesterolemia. This is type 2. Beta lipoproteinemia. This is type 3. And you have hypertriglyceridemia. This is type 4. So the way that we can get started with memorizing all of these is that you have to remember 2 of these. So first one is hypercholesterolemia. This is type 2. And hypertriglyceridemia. This is type 4. And you have to know that these are popular. So you've probably heard of hypercholesterolemia, but you maybe haven't heard of hyperchylomicronemia or beta lipoproteinemia. So both of these are very popular. They are very dominant. So both of these are going to be autosomal dominant. So hypercholesterolemia is type 2 and this is autosomal dominant, and hypotriglyceridemia, this is type 4 and this is autosomal dominant. Now you might say, how can I remember that hypercholesterolemia is type 2 and hypertriglyceridemia is type 4? So hypercholesterolemia starts with a C and hypertriglyceridemia starts with a T after the word hyper. And you know that in the ABCs, C becomes before T. So hypercholesterolemia is type 2 and hypertriglyceridemia is type 4. So this is the first thing we have to know, that hypercholesterolemia is type 2 and it's autosomal dominant, and hypertriglyceridemia is also very popular and it's going to be autosomal dominant as well. Then we have hyperchylomicronemia, which is the first one. It's the top one. And we have type 3 is beta lipoproteinemia, and both of these are going to be autosomal recessive. So you have to know these first. Then we have to know the cause. So what is causing these? So the cause of these, you have to know for hyperchylomicronemia, it's lipoprotein lipase or ApoC2 deficiency. And for type 2 hypercholesterolemia, it's absent or defective LDL receptors or defective ApoB100. And beta lipoproteinemia, it's ApoE. So there's a problem with the ApoE receptors. And for type 4, we have hypertriglyceridemia. This is going to be the cause, is hepatic overproduction of VLDL. So how can you remember all of these? With the simple way to remember all of these is you have to know that type 1, type 2, type 3, and type 4. So LPL, LDL, E, and VLDL. So this way you can remember LPL, LDL, E, and VLDL. So just know these in sequence and you'll know these are for type 1, type 2, type 3, and type 4 respectively. LPL, LDL, E, and VLDL. Now of course with type 1 we said the cause of it is LPL deficiency. Sometimes it's ApoC2. So C2, C2, and you have hyperchylomicronemia. So the C with the C, okay? So ApoC2 deficiency or lipoprotein lipase deficiency. LPL. Then we have LDL, so defective or absent LDL receptors or defective ApoB100. The third one is ApoE, and you have to know that this is the third type, so it's 3. So the defective molecule here is going to be ApoE. So you have to know that E is associated with 3, and this is beta lipoproteinemia. And the fourth one is hypertriglyceridemia. This is hepatic overproduction of VLDL. So LPL, LDL, E, and VLDL. And you also have to know that ApoC2 for type 1 and defective B100 for type 2. Now, sometimes for this step 1, they can also ask which ones go up. So which molecules can be increased. So for example, they say in type 1, which one is going to be increased? For example, is it triglycerides or VLDL, etc. So an easy way to remember this is for type 1, you have hyperchylomicronemia. So from its name, hyperchylomicrons. So the chylomicrons are going to be increased. And of course, when chylomicrons are increased, there's one thing that's going to be increased with it as well. Whenever chylomicrons are increased, then triglycerides are going to be increased as well. So we have chylomicrons increased and triglycerides are increased as well. This is in type 1 and also in type 3. In this beta lipoproteinemia, chylomicrons are increased and triglycerides are going to be increased as well. For type 1 hyperchylomicronemia, what's going to be also increased a little bit is cholesterol. So I'm going to change the font. I'm going to make it blue. You have to know that in type 1 and type 2, cholesterol is going to be increased. So in type 1 now, we know that chylomicrons are increased. What with it is increased? Triglycerides. Also in type 3, you have chylomicrons are increased and with it triglycerides. And type 1, cholesterol is increased, and in type 2 is hypercholesterolemia. So from its name, cholesterol is going to be increased. So cholesterol is increased. And type 2, cholesterol is increased. In type 1 also, cholesterol is increased a little bit. So now we know that in type 1, hyperchylomicronemia, chylomicrons are increased along with triglycerides and cholesterol. In type 2, hypercholesterolemia, from its name we said, hypercholesterolemia, cholesterol is increased, and the cause of it is defective LDL receptors. So LDL is also going to be increased. And you have to know that in type 2, there are two subtypes, 2A and 2B. In 2A and 2B, both of them have increased LDL levels and increased cholesterol levels. For type 2B, you have to know that there's one thing additional that's going to be increased. It's VLDL. So VLDL is also going to be increased. In type 3, this beta lipoproteinemia, which is autosomal recessive, it's caused by ApoE deficiency or it's defective. We said that chylomicrons are increased, so triglycerides are going to be increased with it as well, and also we have a VLDL levels are going to be increased. And in type 4, hypertriglyceridemia from its name is that the triglycerides are going to be increased, and this causes hepatic overproduction of VLDL, so VLDL is going to be increased. So type 4 is the easiest one to remember. Type 4 hypertriglycerides, and you have triglycerides are increased, and it causes hepatic overproduction of VLDL, and VLDL is going to be increased because VLDL is going to carry triglycerides. So both of these are going to be increased. This is for type 4. Now, it's very easy to remember all of these. If we go through it again, we have to know that hyperchylomicronemia, chylomicrons are increased, and also triglycerides with it. And in type 3 as well, chylomicrons and triglycerides with it are increased as well. Then in type 2, we have hypercholesterolemia, and cholesterol is going to be increased, and since it's absent or defective LDL receptors, then LDL is going to be increased as well. Okay, now what? Now in type 4, you have hypotriglyceridemia, so triglycerides are going to be increased, and hepatic overproduction of VLDL, so VLDL is going to be increased. Now you just have to know one thing. VLDL is going to be increased in type 2, 3, and 4. And type 4 is easy to remember because it's basically hepatic overproduction of VLDL, so it's increased in type 2 and type 3 as well. And since in type 2 cholesterol was increased, it's also going to be a little bit increased in type 1. So you have to really memorize these because they tend to come up in the exams. And it's very important to know all of these. By following these rules, it's going to be very easy. Now clinically, hyperchylomicronemia, since it's the top one, you're going to get a top layer in the supernatant. It's a creamy layer. Pancreatitis, you're also going to get pancreatitis and hepatosplenomegaly and xanthomas. You have to also know that there is no increased risk for atherosclerosis, and patients can live a normal life with this, so they can just follow a diet and they'll be okay. Type 2 and type 3 are similar, so they both have accelerated atherosclerosis, tendon xanthomas, corneal arcus, and etc. For type 4, hypertriglyceridemia, okay, this can also cause accelerated atherosclerosis, but what's most important is that very high levels of triglycerides, more than 500, even 1000, can cause acute pancreatitis, and you have to know that this is related to insulin resistance. One more note that is unrelated to all of these is the fact that ApoE. So in ApoE, in Alzheimer's dementia, we have something called ApoE2, and this is going to lead to a decreased risk of Alzheimer's dementia, while ApoE4 is going to lead to an increased risk of Alzheimer's dementia. And these are all the familial dyslipidemias, and this is the easy way to remember all of them.